Okay, na osusunoku higberi UPU United Kingdom President Ejiro Gujabo Owume Wokebe Neme Wokpem Robeje talk na Ihu Ujoni Gbe 101 already on the platform. I want to be honest. Unu oki agbarari UPU osusunoku higberi ekpeme eme wokawa. Beje ekpeme wokoge ne kiebe pastor Igo ne wokenanana. Nunena achare jiroro ufoma ofomi ohoto esekwo akwo fomi na kufia. Kidie belesi coronavirus onyora ohret of rieje vuge. Ona committee bini berwe iroro veromo konya chawo gwo ma itok ne. Itok ne hwana evuro tore noko na ihwo Oduduru Ekwera Gubro is 3.5 million vaccine in. Echo Volvo, you will see BMA, Black and Ethnic Minority Group. Over 75%, at least 72%, Nakare Hall. Amani, UPU, Jenny Wolurobo, came avoid vaccine no for me hoto, o for me nana, I'm no bigger. Organo vuvu go bregana.
Onyo.
Konya wo we obregana no fumi no hotona. Came away vaccine na ware ho. Inna no amen no resi questionnaire survey gave you almost 50%. Votane enyesere ho. Evonere ho. Almost 50% be vuru robona. Tunena buri yibo robo but elie buru robo vo ebri yibo o tore nok na kwebriku e ka retota pa ho ka ke rie biyo unyota ohe vorona iroro onye wo piofomi na iroro veromo ebri yibo na hero ohore se otite ovuga etoto mi we vuga etoto odera evo mi vugerio of Dr. Morris Sanomi Dr. Felix Nomoja Oho kyotite oke gen toto wakuho unyire myoke ehiari urobo kubuhori UPU the president Juno ne otana na nata kwa ho urobo ufuma wori otoru urobo omo robo vovo oromake gu for ki coronavirus era of the Jesus
Yes sir.
Etok ne wana meka wu me woke oke otite Ota kpahihwo eke goho jiroro govuna. Otite. Mi mume wakewe. Woge ebo iyibo organe kwebriku wotota wakuwo. Otite, I hand over to you.
Yeah, Urubawado.
Yeah.
Just like the vice president just said, now, Italia vaccine it prompted or forced an initiative for us to have a pros and cons on the vaccine. And then why we don't live and we have Dr. Morris Sanomi, a qualified doctor since 1986. He's a fellow of the Royal College of Surgeons since 1994. He's got LPC solicitors training since 2006. Start as a panel member of the General Medical Council from 2006 to 2014. And is currently a GP partner in Romford. And then we have Dr. Felix Nomoja, qualified doctor since 91 from Great Uniben. Currently is a consultant psychiatrist with the NHS. I can talk by vaccine and knowledge so that we can all have a knowledge about the vaccine, and that would help us to have an informed knowledge so that going forward we can know whether to go ahead with the vaccine or not. So we have our doctors here who are practicing or working within the medical industry to tell us what the vaccine is all about. So Mika, those that can have a pen and paper should just get a pen and paper just to take down notes as we move along.
Thank you, everyone, for attending this talk about the controversial issue of vaccines. I hope at the end of today, we'll be able to convince you to be part of the program to give coronavirus a kick in the teeth, according to the Prime Minister. So I'm Dr. Felix Nomoja. I'm a consultant psychiatrist in the NHS Trust. And I want to declare some interest. First, I'm a doctor, so you might feel I'll be biased. To make that worse, I've also taken the vaccine, the first dose. So you might think, oh, that's another bias. I'm not a specialist in virology or epidemiology, but my background as a doctor helps me to understand the technology, the biology associated with vaccines. Right, so it will help us to understand this lecture if we have a picture in our heads of the coronavirus. As you can see, it's got a lot of, it's called corona because it looks like a crown. You know, a crown is like an object on your head with things sticking out. Those things sticking out are proteins, and many of the vaccines that have been developed are targeting those they are more or less their legs, which they use to cause all the damage that they do. So most of the vaccines are prepared to cripple those legs, but they are proteins. Okay, so as a way of introduction, we all know that the worldwide endeavor to create a safe and effective vaccine has started to bear fruit because some of the vaccines have now been authorized for use. This has been made possible because coronavirus are a large family of viruses that cause respiratory infections. So they are already known. So it's not, coronavirus is not new. It's a type of virus that is already known. And they tend to cause respiratory problems. This particular disease called COVID-19 is caused by a new form of coronavirus, and it's been given the name SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus. It was first reported in December 2019. Experts have continued to conduct more studies about the effect of COVID-19 vaccination on the severity of illness from COVID-19, as well as its ability to keep people from spreading the virus that causes the COVID-19. These studies will continue beyond the pandemic. It's necessary for it to continue beyond the pandemic. So even though people think it's all very new and very quick, it's going to continue because they will need to know the long-term effect of this virus. So talking about vaccine, it will help us if we know about how vaccine came about. So vaccine haven't just come about now with this COVID. This COVID vaccine is just one of the vaccines that have been developed, going back centuries. Before the vaccine we use now, the practice has been on for centuries before the vaccination actually developed. Like the Chinese people used to drink snake venom with the hope that it will cause antibodies that would then fight off disease if they were to be bitten by snakes. So it's been going on for a long time, but it was Edward Jenner, a British doctor, who first developed what appeared to be proper vaccine against disease, and he developed the vaccine against smallpox. So what he did was he reckoned that smallpox, the pox virus, must be similar to smallpox. And he imagined that if you inject somebody with it, then that might lead to development of antibodies, which will be able to fight off the disease. So he injected an 8-year-old boy. I mean, some literature says 13-year-old, but in any event, he injected a young boy with the sample of the pox virus. And then he found out that the boy could not develop smallpox. And that's how they rolled out the smallpox vaccine, which helped to eradicate smallpox from the world. So vaccines, to develop against disease goes way back. Following from that, in 1885, Louis Pasteur, a French doctor working in France, developed vaccines against the rabies vaccine. So whereas the difference between both were the Edward Jenner's vaccine was live, he injected the live virus into the boy and he developed vaccine. But Edward Jenner thought maybe if we suppress the virus a bit, that might be better. So both of them developed some of the ways that viruses are being developed now. So it was on the basis of Edward Jenner's work that a mass vaccination program was rolled out, which eventually led to the global eradication of smallpox and many other diseases that have been eradicated through mass vaccination. Right. So I put this illustration here just to help us understand how vaccine can help. So if you look at there are three diagrams there, graphical representation. Each one representing different vaccines. So if you look at the one on top, up until 1920, when the diphtheria vaccine was developed, before then, the disease was very high. I mean, among the population, people were dying, and it was a problem. But as soon as the virus was introduced in 1920, from what you can see from the graph, it gradually went down and then flattened out up until 2019. It remains flattened out so long as the diphtheria vaccine is used. The disease has been suppressed. The same applies to polio. If you look at the map, before polio was developed in 1950, it was up and down, up and down. In fact, at the peak of development of the vaccine, it had reached it had gone, from bad to worse. And following the development of the vaccine, as you can see, it went down sharply and then just flattened out since then. In many places, it's been eradicated altogether. The same with measles. If you look at the map for measles, the same thing. It was up and down until the vaccine was developed in 1960. And then it took a sharp downward turn with blips here and there, but then it remained flattened out. So that's the way vaccines work. When they work, they do help, and they've helped the world a lot, because without vaccines, as you can imagine with these graphs, then most of us probably not be here now. Right. So we have to talk about vaccines. So vaccines are an established way of preventing disease. Each vaccine each vaccine producer is utilizing one of several established technologies. So a vaccine producer could use the live attenuated vaccines, which means they will use the organism. For example, if it was coronavirus, they will use coronavirus itself, but they will weaken it so that it can't cause problems. They will weaken the virus, so when they inject it to you, it won't cause problem. Or they could use the technology where the virus has been killed. The virus is killed altogether using chemicals or heat, so that for sure it's not going to cause you problem. But there's a difference in terms of how both of them would provide the length of time they will provide coverage. Then they can also use subunits, just little part of the virus. So instead of using the whole virus, they just take some part of it, which is, for example, the components of the virus, such as the protein, which is what they're doing with the coronavirus. So instead of using the whole coronavirus, they're just targeting those proteins, the one I told you about from the earlier diagram. So they've studied the protein, they know what is in there, they studied it, so they just target those proteins, and they know that if they cripple those legs, the virus is useless. So that's what many of the technologies are doing now, many of the vaccines they are developing now, that's what it's based on. Cripple those legs, develop technology that when you inject into the person's body recognizes them, develop antibodies to them, and once they come in, they just attack, and then they cripple the legs. The virus is rendered useless and can't cause you any problem. Now, because in this country we have the Pfizer BioNTech vaccine, it was important, and because it's a new technology they used for it, so it's important we talk a little bit more about it. So researchers have been working with the mRNA vaccines. So the Pfizer vaccine is an mRNA vaccine, and they've been working on mRNA vaccines for a long time. So it's not new. This is not all just springing out of the blue. It's not new. So they already have prototype. All they needed to do is just develop it further. So that's what they did. So basically what it involves is the mRNA, which is the part of the human genetic code that develops protein, is taught how to. So what it is once you inject it to the person, it's like it tricks the person into believing that the virus protein has come into the body, and then the body will then develop antibodies, so that whenever they see anything that looks like the coronavirus protein, they will be on the attack. So that's what the mRNA virus vaccine is about. So it goes into the body, it teaches the body how to develop antibodies, and then it becomes redundant. Once it does its job, it's become redundant. So there's no question of it going to do anything else. Then the Oxford AstraZeneca vaccine is based on a viral vector. So a vector means something that transports, that carries. So they've used chimpanzee, a virus that causes flu in chimpanzees is what they've used. They've weakened the virus so it won't cause you a problem. Then they've taught it how to get into your body and develop antibodies against the spike protein, which is the protein I showed you earlier. So that's how the AstraZeneca vaccine works. So again, it's not new. The viral vector vaccine is not a new technology. It's been there before. It's well tested. Once the opportunity came, they brought it out and developed it further. Now, I just want to mention that there are many vaccines in development at the moment. Lots of vaccines. At the last count, at least 15 in development. And some of them are already in use. They've been given what they call the Emergency Use Authorization, EUA. And some are still in development. So the ones in the UK, the first one that was authorized in the UK is the Pfizer BioNTech vaccine. Is the mRNA vaccine. It is the first to get the approval, and it is 95%. It's got 95% efficacy. The next one to be authorized was the Moderna, which is also mRNA, but it came from the US. And then the third one in use at the moment is the Oxford AstraZeneca. Biology is a bit different, based on inactivated adenovirus, which are the chimpanzee, the virus that causes flu in chimpanzee, approved in the UK as well. In Russia, they've had one vaccine since August last year. It's also similar to the AstraZeneca vaccine. In China, they have the inactivated virus as well, but because it's inactivated, it doesn't last for long, and it's going to need a booster. But yeah, it's in use already. But there are others that are still awaiting authorization because they are still undergoing tests. You have the one in France, Novavax, that's from the US. But the one that's really going to be exciting is the Johnson & Johnson vaccine. Is due to be authorized by the end of this month. The reason why it's going to be exciting is going to be a single dose vaccine. So once you take the vaccine, you are done. And it's been developed in a way that the way it works is it attacks the virus in two different ways. So it knows that once it gets into your body, the job is done. And it's going to help, because it's a single dose, it's going to be easier to vaccinate a lot of people quicker. So the main thing, so with every vaccine, the most important thing is that it doesn't matter how quick or how long it takes to produce them. There are two key issues that must be satisfied. Once they are satisfied, whether it was fast or it was slow, so long as these two issues are satisfied, then they are good to go. And that's efficacy, that is, it does what it's designed to do, and safety, that is, it doesn't cause you harm in a way that it becomes the harm is worse than the benefit. So these two issues must be happening together for the vaccine to be approved. So you must trust the regulating bodies when they approve this vaccine, because they do take this seriously. So although developing and licensing vaccine has taken a decade in the past, however, in the situation of COVID pandemic, the vaccine development pathway has been accelerated. And this is made possible for several reasons. First, the COVID vaccine, the coronavirus is similar to a lot of viruses that are already known. So once China was the one who isolated what they call the genome of this vaccine and then sent it out. Once it was made public, laboratories around the world went to work, find different ways of using this technology. It was made possible because they were able to overlap and combine resources, and then the urgency made them to work like that. Then government threw a lot of money on it, into it, and that's why it's been made possible. So just as so, if you are still sort of wondering, is this really a problem, or why bother about vaccines? Just think of the Spanish flu. In 1918, the Spanish flu infected about 500 million people, and estimated about 50 to 100 million people died from it. If we were to go back, if we were to get into the mind of people at the time, they would be thinking, where are the scientists when we needed them? Where are all these doctors who say they know about vaccines? Why are they not developing vaccines? Well, there were no vaccines then. So people just died in their millions. The virus basically killed its way into oblivion. It killed and killed and killed, and there was nobody to kill. That's when it went away. So therefore, we should embrace the fact that we have technology to have a vaccine now. So these are reasons to have the vaccine. So if you're wondering, why should I have the vaccines? You should have the vaccine because you need to fight this pandemic that just, getting out of control. The vaccine is our only exit strategy. It is a life and death matter. It is a race against time. It is a race against COVID. It is going around and coming around. Everyone needs to have it, so that at least 85% of people, for example, 85% of people need to have it in order to achieve a herd immunity. So if 85% of people have it, then we're able to develop immunity against the disease together. So everybody needs to be part of it. Even the Pope has waded in asking the vulnerable people, the vulnerable and weak, to be prioritized. And like I said, it's our way forward to eradicate disease. Yes, these vaccines vaccines like every other medication or every other sort of treatment do come with side effects. But according to Professor Fauci, Dr. Fauci, the US vaccine epidemiologist, he's saying that, yes, you will get some side effects, in the immediate aftermath of getting the vaccine. They're usually mild. I took the vaccine. I didn't have any problem the first day. The second day, I had some mild ailments at the site of the vaccine. By the third, fourth day, it disappeared, and that's it. You could get feverishness. You could get, in the worst case scenario, they talk about seizure, brain damage, or death. But this is just saying this is just to, really cover their back. It's not really likely that it will happen. Death can happen because of allergy. If you develop allergic reaction, it can happen. So, but it's very rare. Now, benefit of having the vaccine. So if you have the vaccine, what benefits are you going to get? Based on what we know for other diseases and early data from the clinical trials, experts believe that getting the COVID vaccine may also help keep you from getting seriously ill. So it will prevent you from getting ill. Even if you have the virus, you won't get ill. So getting vaccinated yourself will protect other people around you. It will help the vaccine is going to help to end the pandemic and avert economic disaster. Vaccines may soon also allow international travel to take off as travelers' confidence returns. So there are priority lists. So every one of us will belong to this list. They can't give everybody at the same time. Some people need it more than others. So we'll do that in the priority of how much you need it, depending on how much you are susceptible. So this is the priority list. So eventually we get to your turn. If you haven't been called now, you will get to you eventually. So even if after taking the vaccine, you still have to practice. So according to the experts, after you've taken your second dose, it will take about 2 weeks after for you to get fully covered. So you got to continue practicing all the safeguards that we know, washing your hands, wearing face masks, and social distancing. So you're going to have to continue doing that until such time when it appears the disease is on its way out. So for those people who are hesitant to take the vaccine, let it be known that these COVID vaccines are safe, efficacious, and protect you and your family.
Thank you, Doctor, for that elaborate answer. You took us to the history of the vaccine, how it was developed over centuries ago. You told us about how vaccines has helped flatten different diseases around the world. You talked about the new one at the end of January developed by Johnson & Johnson, which has its own advantage being a one dose. You talked about efficacies, what the vaccine is supposed to do, and the safety around it. And one of the issues surrounding why people skeptical about the vaccine today is about the acceleration the vaccine was developed. Where you talk, government gave it, and a lot of funds were thrown at it, and were able to come up with vaccine in a short time as compared to vaccines in the past. And you talked about the benefit of vaccines, how the Spanish flu killed a lot of people because there were no vaccines at that. And you encouraged 85% of the community need to take the vaccine so as to have immunity. And then you gave us a list, those in the care home down to those of us below 50. And then you encourage us to carry on with the same, as experts have said that the vaccines take full after 2 weeks. So, yeah, that's enough speech. And Dr. Sanomi should take the other part, is answering of questions, because we have part of the survey we did in the past, people asking to run through it. So, over to you.
Thank you to everyone who is here today listening to us. I do hope you can hear me very well. And thanks to Dr. Moja for setting the scene. Like him, I just like to say, as a GP, I just need to declare that as well. It may be that people will also see me as being biased towards vaccines. But the whole idea of today's talk is to address some of the things that we hear on social media, and also to see whether there's any truth or evidence to some of these, things being bandied about. He has said some of the things that I may have on my slides, so I won't go over them, and also that saves us time, and then leaves time at the end for questions. Yeah, so I just as a reminder, I think this has been said so many times that I think all of us now can identify with symptoms suggestive of a possible coronavirus infection. And if we have any of these, this is the time to self-isolate and have a test and wait for the result. However, the three main symptoms are still what they've been: a high fever, or if you have a new continuous cough, or if you detect a change or loss of your sense of smell or taste. Those three are the main symptoms. There are several other symptoms, such as, body aches. Some people may even have gastrointestinal symptoms, diarrhea, vomiting. So it could be a number of other different symptoms, but these are the three main ones to bear in mind. And just as a reminder, some of you would have also heard and read that Blacks and ethnic minorities are more susceptible to the virus and are more at risk of dying from the virus. And it actually said up to about twice the death rate of Caucasians when we as Blacks and minorities contract the virus. So this is a reason for us to really take this seriously, because of this increased risk for us as a group. So I just said I'll give you just a quick rundown of statistics, and these were last updated as at 14th of January, which was 3 days ago. So as you can see there, worldwide we have about 92.3 million infections, of which 1.98 million have unfortunately died. In the UK, we've had about 3.21 million infections, and we've had about 84,000 plus deaths. I'm sure these numbers have gone up since these slides were prepared. As at the time, as at 7th of January, there were about 314,000 hospitalizations, and we had about 3,000, roughly 500 patients on ventilators, mechanical ventilation in hospital as at the 12th of January. So this is quite a huge number of people who can't breathe by themselves. They're being helped to breathe by ventilators, and this is because they've contracted coronavirus. So just to put some, context to what we're talking about today. You all have also heard about the new variant, B.1.1.7, which was reported recently in the UK, and has been blamed for a more rapid spread of coronavirus cases. People are thinking, is this more virulent, or is this going to cause more problems? Whilst we know that it's spreading more rapidly, there has been no evidence to suggest that it's more deadly than the previous or than the one that started it all off. We've also heard about so many other variants, and I think they mentioned one, South African, Brazil, and a few others have been mentioned more recently. So we're getting the virus mutating and producing new variants every time. So I know Dr. Moore just talked about vaccination, and just to say, as at the time this was prepared on 12th of January, they had given about 2.6 million people the first dose, and about 500,000 roughly the second dose of the vaccines. So my main emphasis today is to talk about what's been happening on social media, the so-called myths. We've heard so much that I thought addressing them may help us understand and may help people decide whether or not they want to have the vaccine. So I'm just going to touch on each of them. There may be others, and at the end of the talk, if there's any that we haven't addressed, please feel free to raise it, and we can then also talk about it. So one common one is that this vaccine will introduce a microchip into everyone who's been given the vaccine. People talk about the sign of the beast, 6, all of that. So that has been bandied about on social media. But I think what we should do is take a step back and just reason this for a minute. A microchip is not something that you can, hide and not be able to see, because the vaccines, we have them, you look at them, these are liquid, you can see through them. There's no evidence of any particles within the vaccine. And also when you take the bottle of vaccine, it's not one per person. You take several doses of the same bottle and inject several people with the same bottle. So you get about 8 to 10 doses of a bottle. So the question we should be asking is, if there's a microchip, how does the government know which 10 people have had the vaccine from this one bottle, and how are they going to track everybody who's had the vaccine? We also need to ask ourselves, if the government wanted to track us, is this the best way to do it? Are they not already tracking us with our phones and other methods? We've had several other vaccines before now, so why the coronavirus vaccine? If they had wanted to track us, would they not have used all the other ones available? So I think it's really thinking around it to say, is this a reasonable idea or suggestion? Are we just being too afraid of something new? Is it preventing us from having the vaccine that is something that can potentially, save us from a more deadly disease, the pandemic that is ongoing? So I've looked and I've searched and I can't really find any evidence to suggest that there's a microchip inserted in the vaccines and that the government, not just one government, but all the governments of the world have come together, or some people have come together, convinced all nations and all their governments to put a microchip into a vaccine so they can track every one of their citizens. So I think we really need to think about this critically. I haven't found any evidence that there's a microchip in the vaccine. The other one that's making waves on social media is the fact that the vaccine, once you have it, is going to alter your DNA. And Dr. Moja has talked briefly about what mRNA is, and that will help us understand some of the things people say and how they are not possible. The DNA is your building block. It's in the middle of your cells, the nucleus. The vaccines, there are two of them, mRNA vaccines, and they work by sending a message for the body to produce the spike protein of the virus, attacks, and are ready for attacking the virus in future when they come in contact with it. The other one is the adenovirus vector, which has nothing to do with introducing mRNA into the body. However, the DNA is not affected by the vaccine. The vaccine doesn't get into the center of the cell, the nucleus, so it's not going to alter your DNA. So again, this is all false. I think this rumor came about because people heard about mRNA. Next slide, please. So the other thing that people are saying is that this vaccine will give you the virus. So if you really think of it, the vaccine does not contain the virus itself. It's an mRNA. It doesn't have the virus. The second one, the AstraZeneca one that uses an adenovirus vector, uses a weakened virus, a genetically modified virus that is impossible to cause disease in humans. So this vaccine will not give you the COVID or the coronavirus. So again, this is something that's been making the rounds. One of the things that happen with the vaccine is when you get the vaccine, you're not immediately protected from the virus. It takes a period of seroconversion. And that seroconversion is how long it takes for the body to react or respond to the vaccine to produce antibodies and to produce them in enough numbers to be able to protect you from the infection. So this process called seroconversion can take several weeks. And during that period, if you've already been in contact with the virus, this vaccine, before it takes effect, will not protect you from that virus. So you may still go ahead and express the effects of the virus that you've already been incubating before having the vaccine. So if these two events coincide, people may get the feeling that, oh, I've just had the vaccine, now I have the virus. So that is not true. the vaccine does not give you the virus. When you've had the vaccine, as the body responds to it, reacts to it, produces that immune response, some people may come up with certain symptoms. So you may have like headaches or feel a bit achy or feel a slight temperature, but that is normal with a lot of vaccines. It's not unique to the coronavirus vaccine. So really the message here is, yes, the vaccine can make you feel like that, but it's not because it's giving you the virus. It's an indication that your body is responding to the vaccine and is producing antibodies. And these are some of those effects that you're experiencing. And the second reason that may happen is because you already may have been in contact with the virus, and this process of seroconversion hasn't taken place. Your body has not produced enough antibodies. Therefore, the virus that you were already incubating may now express itself as an infection. So the virus or the vaccine does not give you the virus. It doesn't contain the virus in the first place. So I think this has, people say that the vaccine was produced too quickly. Therefore, it's not been done properly. It's not effective. It's not safe. I think this has been addressed already by Dr. Umoja. mRNA technology has been around for a while. It's been trialed, in trying to develop vaccines against other coronaviruses, such as the MERS and the SARS. So that technology is already there. So it's like having a prefabricated house, and all you're doing is bringing all the pieces together, and you're able to build a house within a week or a few days. It doesn't mean that that house is not a good house. It's just that you've already got the building blocks somewhere, and you're just assembling them. So a lot of time was saved because that research was already ongoing. And that speed, therefore, does not take away from the efficacy of the virus, of the vaccine, or the safety of the vaccine. So these are all things that we need to bear in mind. So speed itself was possible here because some of that research had already been done. And therefore, the manufacturers were able to build on that background research. And Dr. Umoja mentioned as well that the virus was isolated by the Chinese, and therefore once the genetic code of the virus was known, it was possible to then target it with vaccines. That development process was quick. What may have actually taken time is the testing, the trials. So you may find that the trials took longer than the actual development of the vaccines, and that's why it actually took this long. So being too quick is not an issue. It doesn't mean it's taken away from the vaccine. We're used to vaccines being developed over, many, many years, and that is true. Another thing that's made it quick is because when you have a pandemic, you've got a lot of cases around to work with, unlike where you don't have enough cases and you're waiting to have enough numbers to be able to carry out a trial. So because we're in a pandemic, there was no shortage of cases of coronavirus, individuals that can be used to help with the trial or to look at some of the evidence from the trial. So this is just really why it may seem that the vaccine was developed too quickly. So it shouldn't be a source of worry or concern for, to us as individuals in terms of the speed. So I think some of these questions are also some of the myths going around on social media. And I think one of them is the COVID vaccine mandatory? As far as I'm aware as a doctor, there's nothing that has been done from a medical perspective that is mandatory for us to do something for someone, especially giving them medication or vaccination. So this is why some people refuse vaccinations, and all you can do is give them the information, let them make up their mind, just like we're doing today now. We're talking to you about COVID vaccines. It's not mandatory. It's for you to make that decision, but to give you enough information to help you make that decision. So if you talk about, is a vaccine is it mandatory? The answer is no. And there's actually UK law, Public Health Control of Diseases Act. And in there, it actually states regulations may not include provision requiring a person to undergo medical treatment. And medical treatment includes vaccinations. So there is law saying that you cannot compel someone to have medical treatment, which includes vaccination. So the simple answer is no, you will not be forced to take the vaccine. There may be other situations or conditions that may push people to go and have the vaccine. So for instance, if they say, if you don't show your vaccination certificate, you cannot board this flight. And if you think that flight is so important to you, then you go and get the vaccine. I'm not saying that that's happening presently, but we never can tell what the future may bring. But presently, there is no law that says you must have the vaccine. Are there side effects or adverse reactions? And again, I think Dr. Nmo just talked about this, so I'm not going to dwell on it, but side effects are possible with any drug or any vaccine. The typical thing is if I tell you I'm giving you medication and ask you to watch out for side effects, even if I've given you water or injected you with water or something, you're bound to see people come up with side effects. And this is a fact of life, and that's been done. People take placebos, maybe some sugar or something, and they're monitored. And they don't know that they've been given sugar, they think they've been given medication. And some of them will come up with all sorts of side effects. So every medication, even paracetamol that we take every day, you don't even think twice about it. If you go and read the leaflet, it will tell you that, so many different side effects, including liver damage, but that doesn't stop us. We don't even think about it. So something new is bound to generate some anxiety, and that's understandable. And the answer to this is yes, there are possible side effects, like with every other medication or every other drug that's already in existence. So this is not new. But the common ones are, like Dr. Nmo just said, injection at the pain at the site of injection, muscle ache, maybe headache. So those are the common ones. People talked about severe reactions, which we haven't really seen in practice, but I know there are stories of people who had reactions to it, where those reactions have been severe, but that's in the minority, if anything. Given the number of people who've had the vaccines, that's really very minimal. And this is another thing that's been asked on or bandied about on social media, that the vaccine actually contains human fetal tissue. I can tell you for the Pfizer and the Moderna vaccines, which use mRNA, the simple answer is no. For the AstraZeneca Oxford vaccine, the answer is no as well. But I think that rumor came because the AstraZeneca Oxford vaccine uses the adenovirus vector. Now, Dr. Nmoja mentioned this as well. Adenovirus vector used here is the one that causes common cold in chimpanzees. So for them to get enough of the virus, they had to grow it in human tissue. And in this case, they used human embryonic kidney tissues, not the MRC5 cells that was mentioned on social media. They used the HEK, human embryonic kidney 293 cells. And that is just to grow the virus. But the vaccine itself does not contain human fetal tissue. It's just like if you imagine you want to plant, vegetables, and you put manure and a lot of stuff into the soil, and you plant your vegetables. When they grow and you harvest them, they don't necessarily contain the manure itself. So that's the way to look at it. You plant your oranges or pepper or something, they grow, you go and harvest them. They don't contain the manure, but you use that manure to grow them. So it's a similar scenario. The human embryonic kidney cells have been used to grow enough of the virus to be able to make the vaccines, but the vaccines themselves do not contain human fetal tissue. Another question is, I've already had coronavirus confirmed or past symptoms. Can I still have the vaccine? And the answer is yes, you're actually encouraged to have the vaccine. And the simple reason for that is, one, some people may have symptoms they attribute to coronavirus. Who knows, they may or may not have had coronavirus. So it's no use assuming that I've had infection, therefore I don't need a vaccine. That's one. Secondly, some of these tests, we know no test is 100% true. So you may have patients or people who had the test and it says positive and it may be a false positive. So that is part of this scenario as well. The other thing that can happen is, yes, you've had the coronavirus infection. We're not sure how long that immunity from the infection will last. So it's also advised to have the vaccine because of all these various scenarios that are painted. Ideally, if you've had the infection, you should wait about 4 weeks before you have the vaccine. That's the only sort of a caveat to put into the equation. If you've had coronavirus, you're encouraged to have the vaccine. If you have symptoms or you've just had it, wait 4 weeks from that time before you have the vaccine. If I take the vaccine, do I still need to take precautions such as masks and social distancing? Again, yes, you still need to for a number of reasons. One, having the vaccine, you're told that the vaccine, even if you say 95% efficacy, there are 5% of people who will not develop enough antibodies. What happens if you're the 5%? What happens if you're around people who are those 5%? The virus itself. So really, yes, having had a vaccine, you need to still take all these precautions. And the thinking is this will carry on until we've had herd immunity. When you have herd immunity, it means the rate of circulation of the virus is very low, and therefore the risk of infection is also very low. Therefore, some of these precautions may begin to be scaled back. But for now, whether you've had the vaccine or you've not had the vaccine, you need to still take those precautions because we're not sure in terms of, the other people, the remaining 5%, we don't necessarily know who they will be or whether you will be one of those 5% without enough antibodies. So you may still be either at risk or you may still be spreading it to people. So even if you yourself have now been protected by the vaccine, you can still develop the infection, but it won't make you ill, but you can spread it. So again, that's a reason for carrying on with the social distancing and all the other measures in place. So if you are protected, if you carry the virus so you don't spread it to other people, you still need to wear your mask. So that's why we say, yes, you carry on with with taking those precautions. Can the vaccine make me sterile? Again, there's no evidence that the vaccine affects fertility. There have been some trials in animals, and that hasn't shown that it affects fertility. But obviously, everything new, you need to give it time. There was the advice that if you're planning to get pregnant, you should avoid getting pregnant within 2 months of the second dose. However, more recently, so on the 30th of December, the Joint Committee for Vaccinations and Immunizations have reviewed this, and they've reviewed the advice. So now they're saying, if you're planning to get pregnant, you don't need to wait these 2 months that was there before. If you're pregnant, before it was said you should not have the vaccine, or if you're breastfeeding, you should not have the vaccine. But now they're saying, if you're pregnant, breastfeeding, and you fall into the very vulnerable groups, you should discuss with your doctor and weigh up the risks and the benefits about having the vaccine, but it should not be an automatic bar to having the vaccine. So really, pregnant people, breastfeeding mothers, they can have the vaccine, but first of all, you do a risk-benefit analysis to decide which is more of a risk. Because if the pregnant woman then has the COVID infection, it can be a risk to them as well and to their baby. Some people can have miscarriages and other things can happen. So it's really which is a lesser evil. So if you're a pregnant woman, if you are in a vulnerable group, discuss with your doctor about the possibility of having the vaccine. If you're planning to get pregnant, you do not now need to wait for 2 months. Like I said, this is just something that's been changed in the past couple of weeks. As we know, it is a developing story. A lot of things change. Guidance change as well. So this is a change in the guidance from, 2 weeks ago that you don't need to. But the key question here is, can the vaccine make me sterile? And there's no evidence that it affects fertility. So the big question here is, should I have the vaccine? And I would say yes. We've looked at all the evidence. We've said so much today about the vaccine. We've not found any available evidence to say having the vaccine is bad. Obviously, we all know about COVID. We probably know someone who's had COVID. We hear on the news how many people are dying. In a day, you may have 1,000+ people dying. I showed you statistics presently of about 2 million people died presently from COVID-related infections worldwide. In the UK, we're probably heading towards the 90,000 dying because of COVID. So COVID is really causing a lot of problems for people. And we need to think of not just ourselves, but of the people around us. So if you say no to the vaccine, you're not just denying yourself the opportunity to protect yourself, but then you may also put people around you, your loved ones, your colleagues, and other people at risk because you've said no to the vaccine. However, this is an individual decision. We're not here to say we don't have the power anyway. We're not here to say you must have it. We're just giving you that information to help you make up your mind, make your own decision. However, we encourage people to have it, but there are a group of people who on medical grounds may be advised against it. I know Dr. Umoja has mentioned those who should have it. So I've got a slide on those who should not have it on medical grounds. So the advice is have it, protect yourself, your loved ones, your community, the NHS from the risk posed by the virus itself. And again, we all have children. There may be kids who are underage. Presently, the vaccines are licensed for use from age 16 for the Pfizer, and then 18 for AstraZeneca and the other. So basically, if we have kids who are on that, that age group, it's still being looked at to see whether or not children who have currently been excluded from the groups with vaccination should have the vaccine. That has not been decided upon yet. But the point I was going to make here is if you do then have kids who cannot decide for themselves, think carefully. Don't just think about yourself. Think of them as well. So if you say no to the vaccine, should you be saying no to the vaccine to your kids as well? Are you depriving them? Are you using your own judgment to say no to them and putting them at risk? So you put all that into the equation. It's a big equation. Don't just think of yourself. That's what I mean by what I'm saying. Think of the wider society, the community, the strain on the NHS. In fact, my local hospital here are having to treat people in the back of ambulances. ITU is full, beds are full. I know there are videos going around on social media saying, oh, here, look at this hospital, everywhere is empty. Where are all the patients? That's because hospitals have closed their doors to routine work so that they can focus on COVID wards and ITU. So the hospitals may look empty, but that's deceptive. If you really go to where these patients are being managed, then you will understand that we have a huge problem on our hands. And like I said, most of us here may probably know one or more people who've had COVID, or people who have even lost loved ones. So we should really take this seriously and consider taking the vaccine. So that's really all I've got to say on this. So I did say earlier on that there may be a group of people who are advised not to have the vaccine for medical reasons. The vaccine manufacturers have specified an age. So we can't do anything about that. If they say not to be used for less than a certain age, we have to obey that. So if you've had an anaphylactic reaction, so this is a serious, immediate reaction to the vaccine, then you shouldn't have it. So if you've had a dose and you react like that, don't have the second dose, basically. If you've also had a confirmed reaction to any component of the vaccine, then you shouldn't have the vaccine. If you have a history of immediate onset anaphylaxis to the vaccine, again, or to any other medicines or food, then you should, consider not having this vaccine. You should then have a discussion with your doctor to see whether or not it is safe for you. But these are groups presently that have been advised against having the vaccine. I did mention about pregnant women and people planning to. So this is now, the advice has now changed, so you can't ignore that. So if people are pregnant or planning to get pregnant or breastfeeding, the Joint Committee, like I said, has now revised their advice. And that's been done in the past couple of weeks to say if the pregnant woman or someone planning to get pregnant or breastfeeding, if they have enough reasons to have it, then it should be given, because there's no evidence to the contrary presently to say it is harmful to them. And this two months rule presently is no longer there. So people should not delay getting pregnant just because they've had the vaccine. That's the current advice. Okay, so this is, again, people who shouldn't have it. If you've had infection in the last 4 weeks, like I said, if you've had a dose in the preceding 21 days, or if you've already had a complete course, again, you shouldn't have it. So I'll skip that because Dr. Umoja has already talked about that. And then just precautions after having it, you're advised to wait for about 15 minutes just to make sure nothing happens. And so far, like I said, we haven't had much of issues with people who have had it. And these are just where to find further info. And I think that's the last slide, if I'm not mistaken. Right, so thank you very much for listening. And if you have any questions, and I'm sure there will be, and we already had some from the survey, we can then tackle them. Thank you.
The process for asking a question, if you have a question that you want, we have very, very limited time. Please raise your hands on the platform. So you see the functionality for raising your hand. If you raise your hand, keep yourself muted. When I call you and then ask a question, if you want to direct your question specifically to any of the two doctors, please say so.
Thank you very much. And thank you to the doctors for your excellent presentations. I think it's most needed in the community. It seems to me that we are fighting two battles, two pandemics. One is the COVID-19 itself, and the second one is the misinformation that's going on in the community. And the misinformation that Dr. Sanomi talked about, they just don't come up by themselves. People are creating these videos, creating these documents, and sharing them around the community. And it's also clear that they are targeting the Black community with this sort of nonsense information. And some of us here are culpable in helping people to share all this information. So I think given the damage that that is doing, it's important that we encourage everybody to be very careful what we share into our community. My specific question, one is, you've mentioned the number of vaccines. If you're called to your GP to take the vaccine, can you choose which vaccine you take? And then the second question to the first speaker, you've mentioned Johnson & Johnson's vaccine, but you didn't quite describe which category of vaccine that belongs to. Is it an mRNA one or a virus-based one? Thank you.
Okay, thank you. We will take one more question.
Yeah, thank you, everyone. My name is Chus, calling from Canada. First and foremost, thanks to Dr. Desiri, who invited me into the platform. And it has been very informative from both doctors, and I've been listening to all the presentations, and they're quite informative. So from a frontline perspective, I just want to confirm, what is the longevity of these antigens that we have in these vaccines? For instance, I know maybe 4 years ago, I used to have a flu shot, and taking flu shot in North America. And then if I eventually have flu or caught flu, is going to, I'm going to be in the worst case scenario, having all the major symptoms. But in some years, when I don't have these, when I don't take these flu shots, I end up having mild symptoms. So what I'm trying to say here is, okay, every year we take flu shots. So on the vaccine aspect of it, what is the life of the antigens that we are having in these COVID-19 vaccines? So that's just my question for now. And thanks for everyone, and thanks to Dr. Izwe Desiri for inviting me to this informative session. Thanks.
In terms of misinformation raised by Nero Ujabo, this is very true, because we may be missing out as a community on the opportunity to improve our own herd immunity, because you look at people talking about herd immunity, you need to vaccinate a certain number of people to get that herd immunity. And if within our community people are refusing to be vaccinated, it may be that when the virus is circulating at low levels in other communities, we are still having a high rate of circulation within our own community. So we need to address that. And specifically, the question about can you choose which vaccine you can be given at the GP surgery, that I can address as a GP. What the practice is currently, because of storage requirements, the vaccines are administered at specific centers. We don't have them within the GP surgery. So patients are booked to go to those centers, and the vaccines are delivered in batches, and it's really what's available. So if you're booked in to go and have the vaccine, it's what's available at that center that you will be offered. And if you say, no, you want to wait for a specific one, that cannot be guaranteed. So you can't go to, you can raise your choice, or, what's the word now? You can tell your GP about the one you prefer, but it may not be readily available. It means you're delaying your vaccination, and that can put you at risk. So if I leave the other one to Dr. Umoja about Johnson & Johnson, maybe you can answer that.
Yeah, thank you very much. So the Johnson & Johnson vaccine is similar to the Oxford AstraZeneca adenovirus-based inactivate weakened adenovirus from the chimpanzee flu vaccine. In addition to the fact that it develops antibodies against the protein of the virus, it also activates the T lymphocytes of the immune system. So it's a double-pronged attack it has. And that's what gives it that efficacy that it can be delivered in one dose.
The last question was on the life of the vaccine, or how long. And presently, no one really knows, but people are thinking it could be about 9 months for some of the vaccines before the antibodies run out. It's still early days, so we don't really know, but that's the information. Initially, they were thinking when you've had the actual infection, you may develop antibodies, and after about a few weeks to 3 months, those antibodies will disappear. People are thinking that the vaccine itself will give you longer protection, but even at that, they're thinking, could it be 9 months? Could it be 1 year? No one can say presently. So it may be that we'll have to have a COVID vaccine once a year. We don't know yet, but it's still, being debated, because it's only just now, the vaccines are only now just being given. You can only measure their effect further down the road.
Okay, thank you very much, Doctor. Can I just use this opportunity to also acknowledge the presence of two doctors? Please feel free, if you want to add anything to the conversation, raise your hands and we'll give you preference. So we have Dr. Daniel Osegie, who is also a GP practitioner, or a GP in the UK, and also Dr. Adesiri Izu, who is joining us from Abuja. So you are very much welcome.
To people with hypertension and diabetes, take this vaccine.
Just quickly for this lady's question about high blood pressure, the answer is yes. That's a straightforward answer.
Because I'm just going to say very quickly, I'm project leading the vaccine in my area in North London. Mm-hmm. And there's something really important that came to our attention this week. Last Friday, about some people going to different sites to take the vaccination. And they take the first dose, which would be Pfizer, and then they go to a different site because they're desperate to take in 21 days and they go and take AstraZeneca. I just wanted to raise that very quickly, that people should not be mixing. I just really think that's really a very vital question. I'm Vivian, by the way. Thank you, Doctor.
Very important, very, very important.
That was very good. Thank you for interjecting, and that's really appreciated. That's noted.
Okay, thank you, Dr. Salome Adesina-Moja, for that very informative lecture. My question is very direct. The new variant is B117,
Okay.
and this vaccine that has been rolled out is for the very first variant. So how efficacious do you think the vaccine will be on this new variant as well?
The first one, taking different vaccines. I've listened to the expert. This has come up recently. Taking different vaccines. It's strongly advised against not to take different vaccines. So what they said was, you must stick to, if you had Pfizer the first time, you must stick to Pfizer the next time. But they did say that in situation where people have moved homes or been displaced, or they cannot find the record of what they took before, in rare cases like that, it was reported that you may well take another vaccine. But on the general principle, it's best if you take second dose of the same vaccine you took before. The one about new variants, efficacy against the new variant, the general advice is that the vaccine is active against the new variant as well. So there's no evidence that the new variants have been able to escape the potency of or efficacy of the current vaccine.
That's very correct about the new variant. What we're hearing is the virus may have mutated, but not mutated to the extent that the spike protein, where the vaccine targets, has changed so much for the new variant to escape the vaccine. So the thinking presently is, yes, the current vaccine will cover the variants.
My questions were in regards to the time you can take the vaccine. Is it set in stone? You can take it 4 weeks. This is after you've tested positive for COVID, or could you take it before or after? And regards to being pregnant or not pregnant, or trying to have a baby, has there been any evidence to say it's safe to take it, to your knowledge, basically?
Okay, hi, I'm Vivian. I'm the one that raised the issue about people taking the vaccination and taking the same one. My additional question to that is that I think there's been some sort of confusion as to where the first dose is given. Initial conversation was that it was going to be 21 days. And I think it's really important for people to realize that it's now 12 weeks, which is 3 months, so that people are not sort of like frantically running in different places to go and take that vaccination.
Yeah, this question is directed at Dr. Salome. He did mention that if any patient was to attend GP surgery, from what I understand from his answer, he said based on availability, that's the vaccine that you'll get. But what I understand is that these vaccines react to people differently. The AstraZeneca and the Pfizer ones react differently. So wouldn't the GP assess the patient first to see if they got any allergies to the different vaccines before sending that person to the hub? So you don't just go there based on availability, you just go there based on experts' advice.
Yes, what I really want to say is more on the aspect of our responsibility as a community. The UPU have a couple of avenues where we have chats and communicate, like our WhatsApp and all of that. And I want to say that going forward, please, we should be careful with respect to what we post in some of these forums, especially with respect to these vaccines and COVID. We've heard now from our doctors, they've very much enlightened us. So I would suggest some of those sensational posts, we are not saying go and take the vaccine or not, but there are a lot of sensational posts that comes up. Most of them are basically false, very, very false. And they could be very, very confusing, very, very with negative impact in terms of information. So please, as a community, Dr. Shanomi has said, let's try to see if we can increase our immunity, our herd immunity in the community. So let's go against posting negative things, sensational stories that are very, very relevant, very false, that we just see anywhere, and then we just throw them on into the UPU forums and chats. Please, let's take that personal responsibility going forward from today. That's just what I want to add. Thank you very much.
If we are going to publish information, we have to verify that it is not fake. The reason being, there are many people with feeble minds that will believe whatever they see. That is why some people in America went to drink bleach because Donald Trump told them that bleach would cure coronavirus. So the position, like the Secretary General of the UPU said, is that we should be very mindful of what we post in our forums. And that's the official position of UPU. There are too many conspiracy theories, and if we choose to listen to those, many more people will die. And the numbers that are being published of deaths in the UK includes many Urhobo people as well. So let us be mindful of that. Thank you very much.
Thank you, President. That was well spoken, and that's noted. I think we've taken enough question now to revert to the doctors.
Time between the vaccines. When this first came out, the Pfizer one, if you remember, came out and they said first dose and the second dose should be 3 weeks after. And then I think the government and the JCVI have looked at the situation and they're thinking if we have to wait to immunize everybody or to vaccinate everybody with a second dose, then we will lose the opportunity to at least get more people to have a dose and give them some protection, rather than waiting for everyone to have a second dose, and then you get less people given vaccination. And I think this is where this is now being stretched from 3 weeks to 12 weeks. So they now said, scrap the 3 weeks and give everybody at least a dose. So you get more people having that first dose, rather than get fewer people having both doses. However, the manufacturers, if you read through the vaccine manufacturers' recommendations, you will find that that's different to the advice being given by the government and the JCVI. But a lot of us are guided by our government. So we tend to then say, well, let's go with what the government is telling us. Even the vaccine manufacturers have stated, give second dose in 3 weeks. The government and JCVI, Joint Committee on Vaccination, they feel that it will be better to at least get everybody to a level rather than only get some people to a higher level. I think that's where this has come from. And they feel that the first dose will give you some level of protection. So if we get a lot more people having that first dose, that is a better bargain or better situation than waiting for only a few people to have the 2 doses. And I think this is where that 12 weeks has come in. So now we're having to tell people that we booked for a second dose, that we've canceled that second dose. That is now going to be within 12 weeks. So this is the issue currently. And that's why we're following the advice to now give the second dose up to 12 weeks after the first dose. So that's the dosing duration. There was the issue about pregnancy and the safety of vaccines. Like I said before, up until 2 weeks ago, they've said, if you're pregnant, planning to get pregnant or breastfeeding, you should not have the vaccine. But on the 30th of December, the JCVI, Joint Committee for Vaccinations and Immunizations, they've reviewed the situation, revised the advice, and they now say, yes, if the pregnant woman is at one of those vulnerable, it's in one of those vulnerable categories, you should have a discussion with her, weighing up the risk and the benefits, and you should then give the vaccine. So it is no longer a complete bar to say if you're pregnant, you can't have it, or if you're breastfeeding, you can't have it, or if you're planning to get pregnant, you can't have it. That's now, the position has changed. And they're saying that if you're planning to get pregnant, you don't have to wait for 2 months. before they're saying wait for 2 months after the second dose before then, going ahead and planning or getting pregnant. So that is the issue, that's the situation rather with pregnancy presently. You must bear in mind that no one has done tests, not just with coronavirus vaccines, with a lot of drugs and vaccines, we don't test them on pregnant women. We don't test them on that category. So really what we know about some drugs and vaccines in the past is from how they've been used and no effect. Maybe accidentally someone's been given a drug and they're pregnant and it's not caused any problems. Then those sort of information pieced together tells us going forward that, oh, perhaps this drug is safe in pregnancy, but no one gathers pregnant women and says, let's do a trial on them. It's not something that's happened before. So yes, for pregnancy, risk-benefit analysis, if the risk outweighs the benefit, then don't give it. If the benefit outweighs the risk, then give it. In terms of the 4 weeks between infection and the injection, that's the current advice, that if you've had COVID, wait 4 weeks before you have the vaccination. Again, that's something that may change, but because this is all new to us, people have set all these things up and said, let's go down this route. If along the line they feel, oh, perhaps there's no issues with giving even when you have the infection, and they may tell you don't have to wait 4 weeks. But presently, we have to wait 4 weeks from the infection before you get the vaccine. And there was a specific question asked by Ovie about choice of vaccine. You're quite right. If we had the vaccines here in the surgery and you pitch up as a patient and I assess your suitability or you give me a choice, I can say, okay, I've got 3 different vaccines. If this is the one you prefer, then let's give you that. But presently, like I said, what's happening? We have vaccine centers, and those vaccine centers store specific types of vaccines. Because Pfizer came up first, most of the centers had just Pfizer vaccine. And therefore, everyone who we have, assessed as suitable to have the vaccine will then go for that Pfizer vaccine. There was no choice. Because of the storage requirements, we can't store them here at the center. And even with the AstraZeneca, even though it says it can be between 2 and 8 degrees, they're still saying for better monitoring and governance and all of that, it still requires to be given at centers. So it's not even come down to the surgeries yet. So as a GP, I can't give you that choice per se if the vaccine is not available. It's either you're suitable for a vaccine or you're not suitable. Obviously, if you're allergic to a component of the vaccine, it would be silly of me and negligent to say you must go and have the Pfizer one, even if you've been allergic to it. So yes, we do take into consideration suitability, but that suitability only goes as far as what vaccine is available. So if we don't have any other apart from Pfizer, that's the one we will measure your suitability against. And if it's suitable for you, then go and get it. If it's not suitable for you, then we say don't have the vaccine, you wait. And this is where we have all those categories in my talk where I said there are people who advise not to have it. And that's because of those allergic. So yes, we do measure, is this vaccine suitable for this person? If it is not, we won't advise it. If it is, then we book them for what is available. So this is where I'm saying, yes, this is what's available. So to answer your question, Ovie, you're right, we will assess suitability, but we're limited by availability. There was also the question about, or a comment about indemnity. I think where this has come from, where the government has indemnified the vaccine manufacturers, I think my feeling is when they started doing all these trials and seeing benefits for drug companies, they may probably say, okay, we're not 100% ready to, because we have to go through a process. The government may say, oh, this pandemic is so much, people are dying, the economy is falling, what you've seen so far is reasonable, let's go ahead with it. And if the manufacturer say, oh, it won't be on my head, if you want us to release the vaccine at this stage, then perhaps you give us some indemnity. I think that's where that may have come from. So it's not because the vaccine is bad, it's because the manufacturers may still be going through their trials and haven't concluded. And if you look at documentation, it says emergency authorization for use. That's what is, the vaccines have been given emergency authorization for use. And that's really slightly different from saying you've done all your trials and we're licensing you, and the manufacturers will say, yes, we finished our trials at this stage. But the government says, we don't want to wait because people are dying, the infection is spreading. Where you are already is showing us that the vaccine is producing benefits. Let's roll it out.
For the 4 weeks after testing positive, the same. I go with Dr. Shanomi. Safe in pregnancy. It was never tested in pregnancy. So according to Dr. Fauci, I was listening to him yesterday. He said we need clinical trials in children and pregnancy for you to be able to give a categorical safety. So it's down to risk benefit. The issue of 12 weeks, highlighting 12 weeks between vaccines. Yeah, I agree with people who have misgivings there, because the initial impression was that you need it 3 weeks after, so that for it to be, because for Pfizer, the first dose confers 50% immunity. The second dose will give you the 95%. So there's a bit of confusion there, but the reality is you'll be able to wait 12 weeks for you to get the second dose and you still be covered. Having vaccine based on safety, as far as I'm aware, the only safety thing you need to disclose before you take vaccine is allergy. If you've been allergic to any medication or injection in the past, you must disclose it. And if that's the case, it's likely they might withhold it. Other than that, the vaccine is available for everybody to take, without any contraindication. We don't know of any other condition besides pregnancy that would say don't take it at all.
And just one thing I wanted to point out, I know there was also some talk about when you read some of these vaccines, it says not for use in, not to be sold or something in US, Canada or something. And people have equated that to mean that the one being sent to Africa is different. And this is why they've listed this to be used in Africa only and not in the US or EU or Canada. I don't know if everyone's heard that, anyone's seen that. That's been spread on social media as well, that because they've listed those countries as not to be used in those countries, automatically means that that vaccine has been targeted at Africans and therefore it is bad. And I think this is not the case. The reason for that is there are licensing issues and also pricing issues. So if I make something for the African market, I'm not going to necessarily expect to sell it to those poor countries at the same price as I'm selling it to the European countries and all of that. So you do get a lot of conspiracy theories looking at that and saying that is evidence that this vaccine was made to kill or sterilize Africans. Again, these are conspiracy theories. We need to bear that in mind, and people see this and they say, oh, I won't take it. But when you really look, do we have any alternatives developed in Africa for Africans? A lot of the drugs we use in Africa have been developed by the West or by some other countries and then sent to us in Africa. So if they've been meaning to do harm to us over the years, some of these drugs that we've been using, we import a lot of things into Africa. There are other ways of doing that harm. So it's not just because COVID is here now that a bigger or better opportunity has suddenly, come up for them to do that. So I think we should also bear in mind when we see things like that, we should try and reason, why would they say not for use in Canada, USA, or Europe? Is there a reason behind it? If we explore, if we dig enough, we dig deep enough, we'll find that it may be due to licensing or pricing issues that they've made that specifically for a different continent. Thank you.
Before I take the next batch of questions, can I then go to the second doctor who is joining us from Abuja, Dr. Desiree Izu.
Thank you so much. Good evening, everybody. I'm so grateful, first of all, to the organizers for this very, very necessary program. As much as I thought I knew about COVID-19, I'm not ashamed to say I've learned a few things from this evening's session. I'm a public health physician in Abuja. I work with the Federal Ministry of Health, Department of Public Health. So I also have a first-hand knowledge of most of the things that have been said here. But since my learned seniors have spoken so much on the technical and academic point, I will deal more on the social aspects of it. They have also touched on some of them, but I would just want to emphasize a few of them. Number one, somebody quoted the Bible talking about knowledge, lacking knowledge was Hosea 4 verse 6. But I also want to emphasize that in as much as we need to look for knowledge, where you get your knowledge from is also as important as the knowledge that you get. Now, many of us rely on the internet and social media. Those are unregulated. So an SS3 leaver, a school leaver, can just write an article and push on the internet. Many people will share it because it's on the internet. They don't even know who wrote it, whether it's somebody who took tramadol. They don't even know who wrote it, whether it's a doctor, whether it's a street person, and off they go, they start sharing it. And that's why I'm going to appeal, just like our President General has said, you in the diaspora, your voice is very, very powerful. In the midst of the lockdown, I had patients who presented to me chloroquine overdose. I had patients who burnt their mouths, trying to use the lime, ginger, and the whatever concoction, you know, and they used hot water and they burned their mouths because of what they heard. Now, just like the President General said, you guys abroad, you're almost like next to God. So your voice has an extra weight. So when somebody in the UK, for example, says COVID-19 is not real, trust me, you don't know the level of influence that thing will going to have even beyond the UK onto here in Nigeria. So I'm going to appeal that, number one, before you share something, be sure it is true. And how do you know it is true? The whole nation is blessed. Everywhere we have doctors. So if somebody forwards an article to you, before you disseminate it, try to reach, even if you don't trust the white doctor, you don't trust the American, you don't trust the British guy, find from your fellow Robo brother or fellow Nigerian who is a doctor or a nurse. See what I heard. How true is this? That alone can help you know the right thing before you share it. Okay. Now, secondly, is the fact that some of us in Nigeria here, we don't still believe that there's COVID. You guys are battling with the vaccine. We are battling with COVID itself. Some people still don't believe in COVID. So I'm going to appeal to us in the diaspora to also join your voices to us over here to try to educate your own families and circles over here in Nigeria that come, COVID-19 is real. It is not an agenda. It is not a plot to make money. No one cannot shut down the economy just because of COVID. So please join your voice to us. Like somebody also said, I hope this will not be a one-off thing, because in this same discussion, we have seen that the guidelines have changed multiple times. Okay, so I hope that in the next few weeks or maybe a few months, another session of this will also be held to leverage on whatever we have gained. I also want to appeal to those who have attended this session that we should be hearers and doers. We have heard so many of all these things. I've been on radio, I've been on TV a few times. And when you finish and you come out the next week, all what you said, you will still see people not wearing face masks. You see people not even washing the basic hand sanitizer routine and the rest of it. And let me stress, like I told them on TV, with COVID-19, the vaccine is just one of them. Like the doctor said, the vaccine does not confer immediate immunity. It takes about 2, 3, 4 weeks after the second dose to now get full immunity. Even at that, even after you get the full immunity, The Urhobo say that I cover myself with the blood of Jesus. The fact that God is watching over you does not mean you should sleep with your door open. Even after you've got the second dose of the vaccine and you feel you are immune, it still does not mean you should throw caution to the wind. Basic rules should still be adhered to even after the second dose of the vaccine. Hand sanitizers, washing your hands, face masks, social distancing, and the rest of them. Finally, I want to appeal to us to have conscience. I've seen a few patients, for example, in my department, we control the port health system. I want to appeal to our conscience. We have seen people who have positive COVID-19 results, positive, not awaiting results, not suspicious, positive PCR results, and they still want to travel. Now, you don't know who you are entering that plane with. You don't know, and there's a possibility of you infecting others. If everybody does what you are doing, you'll be surprised that even your own relatives might become infected elsewhere. So I want to appeal to our conscience, in addition to our common sense, that we know what we are dealing with is already bad. Don't make a bad situation worse by knowingly or unknowingly spreading it. So if you have a positive result, stay at home, self-isolate, take drugs if needed, and then when you recover, you can go wherever you want to go, if it even needs to be held. We're having a very critical meeting across continents now without traveling. So please, if you are positive, just try and obey the rules. Now, I'll close with this. The issues with the vaccine that we are saying are not limited to COVID-19. Now, if you look, I challenge everyone listening to me now to go online or read the leaflets. Yellow fever vaccine, smallpox vaccines, they have also been recorded they have also been documented to lead to death in some cases. But does that mean we stopped the yellow fever vaccine? No, we did not. So why should we also, because of the infinitesimal percentage or the slight possibility of maybe a seizure or a brain damage, and then we just latch onto that and start discrediting the vaccine, oh, sterility, oh, this, oh, that. So the issues with the vaccine are not peculiar to the COVID-19 vaccine. Even paracetamol, that is the most common drug in the world, if you look at the side effects, if you ever take your time to read the leaflet, you will see that paracetamol, among the side effects, is liver damage, kidney damage, even death. Has that stopped us from taking paracetamol? No, it has not. There's no perfect system anywhere. So I think that we should, as people, and thank God for this opportunity, we should continue this process and not just move with any small thing. Like even in this call now, somebody made a mention of a European Commission to reduce African population. Those things are hogwash. So please, please, and please, before you believe or share something, ask. And that's all I'm going to say now. Thank you so very much. God bless the Urhobo community.
Dr. Izu, that was well said. Your perspective is very, very useful, and I think we are very quick sometimes to forget those perspectives. So thank you for adding that to the voices today. Thanks. I think we have Dr. Isigbe back. So can I please invite you to unmute yourself and also give us your perspective?
Hi, I'm Dr. Daniel Isigbe. I'm a GP, but I'm actually got quite strong interest with regards to COVID-19, and not just that, because I've just been at the London School of Tropical Medicine and Hygiene studying there. And in terms of with regards to the vaccine, I think a lot has been said, and a lot of it is very, very good. So I'm not going to add so much more to that. But what I find is, someone mentioned about targeted misinformation, and I think that is the key. That I feel like a lot of people, when it's come to, even before COVID, even before the vaccines, people were talking about 5G, and then people forget about 5G and forget that they were actually wrong about the whole 5G things, and their pastors and religious leaders were wrong about it, and then now it's moved on to the vaccine. And I feel like actually, even when you look at other communities, like for example, in the Asian communities, the misinformation that people provide, people say that there is pork in it because lots of them are Muslims, and people say, oh, there are things in there that are prohibited from eating. So, or there's alcohol in the making of the vaccines in the Asian and Southeast Asian community. So you actually see that all of this is targeted misinformation. We don't get that information as a Black community. We're told about things about some church leaders are saying it's the mark of the beast and so on and so forth, or it alters our DNA makeup and will become the form of a chimera. And the reality is actually a lot of this, most people don't even bother to check it out, and it doesn't check out because a lot of it is not possible scientifically, theoretically, or even in nature. So I think that my take-home message to everyone will be actually that people do your research, and I'll be bold enough to say, because I know I'm a Christian as well, I'll be bold enough to say, actually just check out, regardless of whatever anybody might represent your life, check out the information yourself. It doesn't really matter so much to me whether you take the vaccine or not. I think, yes, we need a herd immunity, but I think everybody needs to make a decision that they are comfortable and happy with, but based on right information. Because I think there's two problems. There's one, the spreading of misinformation, which actually there are people that are dying. And I feel that actually when we're doing this, we're actually contributing to people losing their lives. And I think we need to take it seriously that we're spreading misinformation, that there's going to be vulnerable people that are going to be dying in hospitals or dying at home because they believe that what the information they've got is true. They don't want to go to hell, or for whatever other reason that they're not going to take the vaccine. And whereas somebody like me, I've had COVID before already. I've also just taken the vaccine as well. Even though I had COVID all the way back in March, I had antibodies that are positive, but I took the vaccine now because I'm going to be recommending vaccines to my patients, and I know the science behind it. So I think for me, the main thing is actually just do your research, speak to trusted sources, speak to your GP, and go on nhs.net. Don't look on WhatsApp or YouTube and take that as golden information, because they're not scientists. And scientists is basically, there's a lot to it. We spent years studying all of these things, and it doesn't all just wash away. All the other medications we take and for our health are developed by scientists. They are prescribed by doctors. We're still the same people that have been doing this for years. So I'll just urge people to actually just get your information from the right sources and be critical in the information that you receive from whoever, from family members, from leaders, whether they're religious or otherwise. Be critical in that information and just take a very balanced view to things. So that's my take on things.
Thank you very much, Dr. Sigwe. That was well said. Another excellent perspective. So thanks for that. So we'll get back to the questions now.
I just wanted to add about the second dose. The evidence suggests that if you've only had the first dose, you are less likely to end up in hospital, in ITU. And that's one of the reasons the government is trying to get everybody to have at least the first dose and extending the second dose. I think somebody earlier on talked about protocols around oxygen usage in the hospital. There is no such protocol about withholding oxygen from people, but she might have been in hospital.
Lady Mercy, please, can you give us some background context around your knowledge? Because the claim that you make, you're legitimate in making those claims. Can we just know who you are and why you made that statement about the oxygen at hospital?
Okay, I'm a hospital midwife with special interest in, shall I say, infectious disease for many years. Obviously, because I initially trained in Nigeria as well. And when I did my first degree, I did a module on infectious disease, but it's just something I love, whether, in reality or science fiction. And in my department, I've also taken the lead in the COVID fight. And when it was Ebola time, I did the same thing as well. So around the oxygen usage, it is not that there's any policy. There have been several hospitals who had many patients with COVID that ended up on ventilators. And when you're on a ventilator, it's high use of oxygen. And oxygen is not produced on site. So there were messages that went out to say, could they be judicious use of oxygen? But no one was deliberately deprived of oxygen if they could be given it. And sometimes you have to trust health professionals to know when to give oxygen and when not to give. It doesn't mean just because you have COVID that you necessarily need to be given oxygen. And with regards to the wards, we need to remember that hospitals are hospitals. So if you're admitted onto an orthopedic hospital, they can't say, well, we've just going to put you on a COVID orthopedic ward, because people were sick in hospital before COVID hit. So sometimes you will have a mixture of COVID and non-COVID in the hospitals. But what hospitals try to do is on one bay, they will have COVID patients, and then in another bay have non-COVID patients. And then they will try and ask nurses that are looking after the COVID patients not to look after the non-COVID patients. I also saw something in the chat group about the BAME community. And I think that's a whole big topic, and I was chatting with ECOWA about that today. But all I will say is, as members of the BAME community, we need to take responsibility for our health. And because it's got nothing to do with the government that we are obese, or we have high blood pressure, or diabetes. We need to take control of these to make sure that if we are hit by the COVID virus, because we don't have any other comorbidities, our body has a chance to be able to fight off the virus. But I think it's something we could discuss in another scenario. And then I think someone talked about the not for use in the UK or USA. And I saw one of the medias that went round on that as well. I think one of them as well was not a vaccine. It's the remdesivir, which is an antiviral that I think originally was devised for Ebola. I think there have been some evidence to show that it might work for COVID, but it was put around as if it was a vaccine. So again, misinformation. And obviously a lot of people don't understand that remdesivir is not a vaccine. So again, let's be very careful with what we share, because most people aren't going to go do research. But I would also say most of us have smartphones, which is why we're able to watch this. When you see something posted, don't take it as the gospel truth. Please go and Google it and do your own research so that you will know what, most of the time, what is the truth and what has no substance to it. And again, I will say the quote, "My people perish for lack of knowledge." You've believed the anti-vaxxers, now please try and believe the information for vaccination. And I must say, I have also had the Pfizer vaccine, and I haven't grown an extra ear or an extra nose since I had it. Thank you.
Yes.
Yeah, thank you very much. I want to thank the whole doctors for all their contribution towards this meeting. It's very, very important. I believe we've learned a lot. What I want to ask Dr. Morris now and the other doctors is that people that have asthma, can they still go for the vaccine?
Firstly, just to thank UPU for, can you hear me? Okay, just to thank UPU for having this conversation today, and a very big thank you to all the doctors for their contribution, which has been very, very useful. Particularly, I want to mention what the doctor from Nigeria said, because I was in Nigeria recently and I just returned a few weeks ago. What he said is actually what is trending. They don't believe there's COVID-19. When I was wearing masks, they were asking me whether I have COVID-19. That's why I'm wearing masks. I said, no, I'm going to protect myself and to protect them, and they should do the same thing. They think it's just a ploy by the government to make money from foreign countries and from private companies. So this is one of the reasons why we should stop spreading all these rumors on social media about the conspiracy theories for the vaccine, especially mentioning Bill Gates and so on. Now, coming back to today, I just want to ask this question just for clarification purposes, really for practical reasons, because this is one of the reasons why people think they should not take the vaccine. Can you allay the fears of these people by stating some practical, I use the word practical reasons, I underline that, or specifically for some reason, that could result in people reacting to the vaccines. I know they will say if you have allergy to something, decode beyond the allergy. What are some of the allergies that people will expect? Because some people have it and they don't even know. So let's list some of the allergies that people can possibly have from having vaccines. That's one. Then the second part is about mental health. As a mental health act manager under the act and also a mental health act advocate, considering that taking a vaccine is not a first thing, it's not compulsory, how would the mental health professionals and doctors convince people who have mental health problems, especially those who are sectioned, who don't even like to take their medication anyway, or to take this vaccine? How will you empower them? How will you encourage them to take the vaccine, especially those, some have insight, so they might understand what you're saying. What of those who don't have insight, lack insight? How are you going to discuss this with them and encourage them to take the vaccines? Thank you.
Thank you all for this lovely presentation. It's good to inform our community. Now, what I was going to mention, First Lady, Lady Mercy has already mentioned it, so I won't go too much into that. It was just to emphasize the fact, the issue that was raised about putting COVID positive and COVID negative patients together. I am a midwife in one of the London hospitals, and just to emphasize, as Lady Mercy said, that we don't generally put COVID positive and COVID negative patients together. We do separate them in different bays, and just to be aware that every patient that now comes into the hospital are tested for the virus. So initially we may not know that they have the virus, and as soon as we know, we do separate them into either a side room or different bays. So it was just to acknowledge that previously mentioned. And also with the oxygen, we only give oxygen if a patient needs it by using the saturation level. So my question to the doctors are, let's assume that there was abundance of all the vaccines. Which one would you recommend?
Yeah, thank you very much, Mr. Koko. Yes. I have somebody here with me who wants to find out if someone with very low immunity, very low immune system can take the COVID vaccine. She has a kind of a low immune system that attacks as skin.
The question I would like to ask, two questions. Can the body and does the body produce COVID-19 antibodies without vaccine?
Okay, thank you.
The other one is related to that. Be it that the body can, and I'm assuming your answer is going to be yes, because it has happened. Why is then the vaccine necessary to be taken if it does the same job as the body's natural immune system?
Okay, I think we can just take them in rapid succession.
Please, if you don't mind, so that we can have a closing remark.
Yeah, the first one about asthma, the answer is yes, you can and should have the vaccine if you have asthma. That's part B. About the allergies, I think Jeffy Diabana was asking, on a practical level, is there a way of knowing? I think it is very difficult. We obviously know the vaccines do list what they contain, and obviously you can only go by that. So if people have been allergic to any of those constituents, that's one way. But the other way, or the other thing we say to people, if people already have a strong history of allergies, this is probably just generalizing, but if you're someone who, for instance, has a strong allergy to peanuts or something, you already carry like an injection around, EpiPen or something, those are the kind of people who should really think carefully, and that's why they've excluded or said to those people, then probably you shouldn't have the vaccine. But this is a discussion that they should have with their doctors to make that decision. But finding out who will react, it will just be those people who already react to a lot of different things. That may be a clue, but it doesn't mean they will necessarily react to the COVID vaccine. But it's just taking that precaution to say, this person already has multiple allergies. Therefore, they're the kind of person who is more likely to also react to the vaccine if ever there was going to be a reaction. So it's really treading carefully in those circumstances and looking at discussions with the doctor to make a decision as to whether they should go ahead or not. But presently, severe allergies where they've had an anaphylactic reaction is one of the exclusions from having the vaccine. I will leave the mental health one to Dr. Numoja, but I'll just pick a few of the other ones. There was a question of if the vaccines were available, if they were in abundance, which one would you recommend? I mean, you can look at it from various perspectives. I think in terms of efficacy, people can say this one gives better protection, that one doesn't give as much, looking at percentages, but we are individuals. So the fact that one person has a better reaction or outcome with one vaccine doesn't mean the next person will not have the same, or the difference in the vaccines will produce a better. So you can give the same person all three vaccines. The point I'm making is you can give them all three vaccines and their immune system will not produce as much of the antibodies. So it's not necessarily always down to which vaccine you've given them. It may be down to their individual characteristics. So if you ask me as a doctor, I would say take the one that is available, unless you have reactions or reasons not to take that particular one. Because presently we're rolling this out. What makes some of them more, probably more preferable, if you want to use that term, is the storage. So some of them are stored at -70 and it's difficult to administer those. So if you ask me for practical reasons, I would have the one that I can store easily, not because it's better, but it makes it easier for me to give to my patients because it's only needing to be stored at, say, 2 to 8 degrees, as opposed to the one that needs some storage facility at -70 and therefore makes the administration process less, and makes it more cumbersome. But I don't think there is a choice between them. If you want, you just look at the efficacy alone. That may not be a good guide. So take the one that's available. That will be my, conclusion on that. In terms of people with low immune systems, yes, because the vaccines are not live viruses, people with low immune systems can have them. The only sort of thing to mention here is they may not produce as much of the response or the antibodies as someone who doesn't have a low immune system. But there's no reason why they shouldn't have them because they're not live viruses. So those viruses will not start to produce or multiply in their bodies because of their low immune system. So yes, they can have it. That's the simple answer to that as well. Somebody talked about natural remedies. I think that was Ovie the Redeemer, that you believe in natural methods to enhance the bodies. And we're talking more here about the vaccine. Apologies because this talk has been sort of geared towards talking about the vaccine. That's why you haven't heard much about other things. Obviously, just taking the vaccine without taking other healthy lifestyles is not what we're advocating. You should combine taking the vaccine with taking other precautions. So you've heard before, when we had our last talk, we mentioned briefly about things like vitamin D, making sure we control, other health conditions. If your blood pressure is high, control it. If you're overweight, try and lose weight. If you have diabetes, control it. So a lot of all those things are there in the background, but today's talk was geared, towards really talking about the vaccine, and that's why you've heard so much about the vaccine than anything else. You also said, can your body produce antibodies without the vaccine? And the answer is yes. However, we're not sure how long those antibodies will last. They don't look like, from early indications, that they will last, a very long time. And that's why they're saying still have the vaccine, almost like topping up. So that's really what I have to say about that. But I say the mental health question, if Dr. Numoja wants to take that, please.
Just before I get to that, on the asthma. I mean, asthma and immunocompromised people, the relationship between this and COVID is that these people with this condition are more likely to suffer, severe illness from COVID than other people. So yes, it's recommended that you take the vaccines. And allergies, you talk with allergies, the most serious allergy you worry about is anaphylaxis. And anaphylaxis is idiosyncratic. So it just happens. There's no way of telling who it will happen to. It could just happen. And then coming down to Mental Health Act, Mental Capacity Act, which is my area. And the question, I'm very familiar with all those questions. So what they say is for people who have, like on my ward, we have people who have suffered from COVID. There was a time we were on lockdown. We put them in their room. We advised them to stay in their room. Many of them complied. Those who became very ill, we transferred them to hospital. So when it comes to taking vaccine, if it's it comes down to capacity. So if a patient can decide for themselves, you will give them the information and you will assist them to get the vaccine. If they can't decide for themselves, if they haven't got capacity to make decision, in which case the decision has to be made for them. They have to go through a process called the best interest. You have to do what they call best interest assessment. So, and that's not just looking at them and say, oh, I think based on information I have, I think it'd be good for you to have it. No, it doesn't come down to that. Best interest is you have to try and imagine what they would have decided if they were in that position, and what information do other people have? Has it got any written down expression of preference? So you assess all this and decide whether, and then check their physical health if they can take it. So you do best interest assessment. That's the way to go.
I'll hand over to Otite now, please. If we didn't get to your comments or questions in the chat, they will be recorded and they will be examined subsequently. So thanks for your questions and your contribution. Otite, over to you.
Yeah, thank you, Ekuku, and thanks for everybody attending. Been a wonderful evening. I would hand over the floor now to Presido to give us a closing remark. Thank you.
Thank you very much, Otite. Thank you. First, I just want to thank all the doctors. There's Dr. Sanomi and Dr. Nomoja for all the effort that you're putting into it. The fact that you have provided us as a people, that's reassuring when our own people who are qualified in the different fields inform us about the reality of our times. I just also want to thank Dr. Daniel Osigbe, as well as Dr. Edesi Izu, who joined from Abuja. Your contributions have been immense, and I can assure you that I've spoken to some other doctors of Urhobo extraction even before this webinar, and as a result of my conviction, which has been reinforced this evening, I can confirm that I have personally taken the vaccine. I've taken the first dose of the vaccine, and I will recommend that everybody does the same. Let me thank all the organizers of the webinar. The organizers of the webinar have done a great job ensuring that this takes place today, and the number of people that have attended testifies to the importance of this topic. And all I can say, like the doctor from Abuja said, is that we will spread the word. Let us spread the word, not only to our people here in the United Kingdom, but to our people across the world. Because, like they said, I was also in Nigeria in October, and I can confirm that the attitude is very lax in Nigeria. Let us the word. And I want to thank all those people who have participated today in this webinar.
Urhobo Wado. Ete mana kebe presented China. Ihole je esi odoto. Ihole je nwe yakugbobe vore UPU. America no the post-hoc survey, AKVOBO, Kiebe Konye Nano, Urubose Nano, question and answers. Ebe amre otata nunena. Ebe amre hwa. Aroma totana na ke mavo ihurubu ikarere he vaccine. Okare pia wo ansona ye odokana. Miroro boy committee na gware hiare amakobiro awoma there is going to be a follow up ekwa COVID-19 ke miroro na okeri protore so agware hiare awoma the team on or before June on or before Father's Day come Sunday 20th June there will be a follow up of the same seminar to review the situation where we are. Robo, especially in the UK and Nigeria.